Hi, Faith.
Hello and welcome. My name is Faye Johnstone. I use she and they pronouns, and I am a principal consultant with Wisdom to Action. Wisdom to Action is a progressive consulting firm and social enterprise specializing in community engagement, knowledge mobilization, and 2S LGBTQ+ inclusion. Over the past year, trans and gender diverse communities have felt the disproportionate and crushing impact of COVID-19. Today, we are gathering to highlight new resources developed in partnership with Wisdom to Action, the Canadian Public Health Association, and of course, trans communities. It is our absolute honor to launch these resources to help support frontline service providers and public health agencies in the provision of a trans-inclusive COVID-19 response. These resources launched today can be found on www.wisdomtoaction.org/trans-inclusion. Created in partnership with service providers and members of the trans community, these tools are essential to help service providers and organizations involved in the COVID-19 response provide more inclusive and affirming services to trans and gender diverse people. Ranging from information on the proper use of pronouns to templates for intake forms, we've designed these resources to help healthcare providers put in place concrete and practical changes to support trans communities in their everyday practice. We'd encourage you to share why a trans-inclusive COVID-19 response matters to you on Twitter, Instagram, or Facebook with the hashtag trans-inclusive-COVID-response. We appreciate anyone who shares about the impact of this work and the importance of a trans-inclusive COVID response, either from their perspective as a community member or as an ally or service provider. Now, over the past year, we know and have seen the impact of COVID-19 on trans communities. From coast to coast to coast, trans communities have been disproportionately impacted by this pandemic. Our communities, which already grappled with financial precarity, with poor mental health, and a lack of safety in public, not to mention unequal access to health, community, and social services, have now had to cope with the additional impact of a global pandemic, resulting in greater isolation, greater financial precarity, and unfortunately, continued discrimination while seeking to access COVID-19 testing, care, and vaccination. Our communities have long struggled to access inclusive health and social services. Many of us have faced discrimination while trying to access healthcare that should be designed to help us in our time of need. Despite progress, despite significant steps forward, discrimination persists across our sector, both within and beyond the COVID-19 response. While we know very little about the experiences of trans folks during COVID-19, research from Trans Pulse Canada indicates that of those trans folks who have sought COVID-19 testing and care, over 10% have had discriminatory experiences while doing so. COVID-19 is not the only crisis facing people in Canada. Rather, COVID-19 has exacerbated existing inequalities and crises and shone a spotlight on our collective failure to deliver a truly just, equitable society. As we continue to roll out COVID-19 vaccines, it is of the utmost importance that our community, health, and social services take the necessary steps to ensure trans people and all of our communities have access to non-discriminatory and inclusive care. And that's what these resources, above and beyond anything else, are all about. These resources, developed with service providers and with trans folks, are action-oriented and practical. We know that by and large, service providers want to provide trans-inclusive care, but often don't know how and don't know where to start. That's why these resources are a big step forward. By helping service providers unpack gendered assumptions, introduce inclusive practices like asking people their pronouns, and providing guidance to organizations on how to communicate their commitment to trans inclusion, and so much more. We hope to help everyone and anyone working in a COVID-19 response or in the COVID-19 response, be in a clinic, in a hospital, or vaccination program, provide inclusive, caring, and compassionate services to trans and gender diverse communities. Now, we know these resources are just the beginning because trans inclusion takes time. It takes dedicated resources and it takes hard work. Across the community, health, and social service sector, we know we still have a long way to go to dismantle transphobia and ensure our spaces are safe for trans and gender diverse communities. We hope these resources will help you on that journey. Now, I have the utmost pleasure of introducing Niko and Alex, both of whom have been instrumental in the development of these resources and who have brought their perspectives and expertise as both community members, service providers, or consultants working in this space to ensure that these resources respond to the unique needs of trans communities while relating to the experience and needs of community health and social service workers who are already struggling themselves in the face of this pandemic that has gone on for month after month after month. I'd like to start by introducing and welcoming Niko Stratis, a Toronto-based trans woman, writer, and activist, to share why these resources matter to her and how she hopes they will be used. Niko, I know you've had yourself some negative experiences accessing COVID-19. Could you start by telling us a bit about yourself and what that experience was like?
Hi, Faye. Thanks for having me. Thanks for asking me to be here. My name is Niko Stratis. I use she, her pronouns. I'm a Toronto-based writer, speaker, consultant, etc. I'm going to talk a little bit about experiences that I've had so far throughout this pandemic. I've been tested multiple times for COVID-19. One of the times I have accessed testing services, I was in a line with other people, testing clinics, very busy. And when I got up to the front and they took my identification, both pieces of photo identification, after looking at my driver's license and my OHIP card and going back and forth on the speaker that, goes out to the room, the question was asked of me, "So you're a woman?" which was a question and a statement at the same time. I was the only person in that line that got asked that question. I'm the only person that I know that has been asked to clarify my gender, because I guess you can't tell from reading it. In a COVID testing room, I was once told that I should feel lucky because men are less at risk for COVID than women. And then when they looked at my ID again and checked my legally recognized gender, I was told, you know what I mean though, like real women. These are just two stories that I have that are personal experiences with getting tested for COVID-19. Trans people, trans women, trans feminine people especially, have a long history of not trusting medical services, of being discriminated against. I personally have been laughed at by medical professionals. I have been misgendered. I have had people tell me to leave emergency rooms because they believe that I was lying about my symptoms. These are just the tip of the iceberg of how we deal with the medical system in general. This is why we don't trust it. And we are in a pandemic, and it has been going on for a long time. And it is stressful and it is difficult. And it shouldn't be an added layer of stress and anxiety for me to go out and do something as simple as get a test to make sure that I'm healthy. But every time if I leave the house to go and do just that, I have to prepare myself and know that I'm most likely not going to have a good experience. I'm likely going to have to process being misgendered, having my identity called into question, being outed in the room, having other people look at me and stare at me and laugh at me. It's not a pleasant experience. And as we move towards getting vaccinated, the hope is, my dream is, I don't think anybody wants to discriminate me in those spaces and in those rooms. I think people just maybe aren't prepared to have somebody like me walk in. And I want to believe that we're moving to a space where people like me can go and get a vaccine and just feel happy about it like everyone else gets to, and not have to walk away saying, that was good, but. And unfortunately, that's where we are. If we look at the vaccine process in other areas, we see it's clearly discriminatory towards trans people, where trans people are having to do things like disclose their sex assigned at birth, which has no bearing on a vaccine and is really only a line item that is there to out the trans people in the room and to put us in a position of potential danger and at risk. And it causes a lot of harm to our community, a community that already has to process so much harm and so much hardship in trying times. This is why these resources are necessary. This is why I believe in building these resources with healthcare providers and professionals in the hopes of creating a space and creating an environment where people like me no longer have to worry about being discriminated against, where we can go and access services that everyone else is entitled to without fear of discrimination. Thanks for having me.
Thank you so much, Niko, and my heart goes out to you for having had to face those experiences while accessing what should be inclusive and affirming healthcare. And I think your experiences highlight more than ever how important these resources are and how important it is that our response to COVID-19 factors in trans folks and our experiences and resists transphobia in healthcare spaces. So thank you so much for sharing and for helping guide us on this journey. Now it is my pleasure to introduce Alex Vincent, who is a registered nurse working in both trans healthcare and the COVID-19 response. Alex is here to speak to why these tools matter from a provider's perspective. And so I'd like to begin, Alex, by asking you or inviting you to describe the evolution that you've seen in trans inclusion within healthcare spaces.
Thank you, Faye. So hi, my name is Alex. I'm a registered nurse. My pronouns are he and him. And as we heard from Niko earlier, there's been a lot of discrimination against trans folks in the past, but also clearly at the moment. So although we've, taken a lot of really good steps to improve trans healthcare, specifically in Canada, but also in other parts of the world, we still aren't where we need to be. It would be great for trans folks to be able to access healthcare just like anybody else. I'd like to acknowledge that it can be difficult to incorporate trans-inclusive practices in our daily work as healthcare providers, especially when you're starting off. But with practice and trial and error and learning, it does get easier with time. To make things a little bit more difficult, a lot of healthcare framework and tools are not designed for trans folks and don't allow for easy trans-inclusive practices. But there are small things that can be done to improve trans folks' experiences when accessing healthcare. We hope that our tools can help you learn a little bit about the background and history of trans healthcare, as well as get some tools that can help you improve your practice in small ways, but that can have a great impact for folks who are accessing healthcare.
Awesome. Thank you so much, Alex, for sharing a bit of your perspective as a service provider working in both trans health and the COVID-19 response. As you said, I think we struggle with having a lot of patience for healthcare because we know that this work isn't always easy and that embedding trans-inclusive practices does take time. And so I think we're trying to hold that close while also calling upon this sector to move ambitiously forward because we know that trans inclusion isn't new and it's something that we can and must act on sooner rather than later. And that is, as you said, very much what we're hoping these tools will achieve. As we bring our session to a bit of a close today, I want to take a moment to thank the Canadian Public Health Association for their crucial role in making these resources happen. I also want to thank from the bottom of my heart, Niko Stratis, Reinoso, and Alex Vincent, whose personal and professional expertise and experiences have been absolutely essential in creating and refining these resources. I also want to thank Kathryn Leblanc and Brandon Mott, both of whom have gone above and beyond to refine and design these final products. This was through and through a team effort, and in our books, already an immense success. In Canada, simply living as a trans person isn't easy. Despite progress, discrimination persists, and many of us face transphobia and violence on a seemingly endless basis. COVID-19 has made an already bad situation all the more worse. And it breaks my heart that our communities that need and deserve access to health and social services continue to face discrimination accessing care. And so I call upon everyone watching today, please put these resources into practice during and beyond COVID-19. We have a moment here as we talk about building back better to make sure that trans people and trans inclusion is an integral part of our approach. We have the knowledge and the tools we need to create trans inclusive community, health, and social services. It is past time that we make this a priority, advocate, organize, and educate to ensure that trans people have inclusive and equal access to community, health, and social services. I would like to remind everyone to visit www.wisdomtoaction.org/transinclusion to check out the resources and share the hashtag #transinclusive COVID response on your social media to help spread the word and ensure we're reaching as many folks from coast to coast to coast as we can. Without further ado, thank you so much to our brilliant and exceptional content creators. Thank you to the Canadian Public Health Association. And thank you to you for joining in and watching this video and participating, hopefully helping us mobilize these resources across Canada. Have a wonderful day.